Welcome to Primary Care and the New Medical Quarterback. I'm Bambi Francisco Roizen, founder and CEO of Vator, one of the hosts and producers of Invent Health. This is a series running for about 4 years. The purpose of these events is to take a deep dive into one topic. This time we're focused on primary care. We've had different iterations of this topic in the past, future of clinics, reinventing the doctor. But this time we wanted to emphasize primary care because it is preventative care, essentially. We, as patients, providers, and payers, should prioritize prevention and the small cost toward prevention in order to save on the more expensive costs, downstream costs. We have a great lineup today, so take a look at the agenda, but stick around for the entire 4 hours. But before we dive into the actual program, let me thank our sponsors. First, Pivot Inc., an AI-enabled digital therapeutic platform solution delivering evidence-based interventions to help people change their behavior. Their first launch is Pivot, a tobacco cessation addressing the leading cause of preventable illness, death, and healthcare costs on the planet. And then there's Forte, which produces live stream and on-demand fitness classes. Thank you, Forte. And thanks to Advisor, boutique M&A advisory firm, StratPoint, an outsourced engineering firm, and Scrubbed, an outsourced bookkeeping firm. They're all excellent partners. And now I'll turn to my co-host, Dr. Archana Dubey.
Thank you, Bambi. This is Dr. Archana Dubey. I'm practicing physician, Chief Medical Officer Consultant at HP, and Chief Clinical Officer at Alive Core, joining you guys. I'm super excited because I myself am a primary care physician, and we would love to have conversations around the economics and the approaches that different peers are taking. Before I go there, some housekeeping. We love the tweeters, so please tweet your thoughts. You could see right here behind me the hashtags that you could use from our Zoom background and ask questions by raising your hands. You have a raise hand icon on the bottom of the screen, and we will pull you in and allow you to ask questions through voice or through text. We will be dedicating about 15 minutes of our time at the tail end of each of the panel towards Q&A. So with that, let's start a little bit of a top-level conversation around primary care. So for the folks who are in the attendance, let's kind of define what a primary care physician really means. The folks that are the first door to your healthcare experience, generally, they are either family physicians or they're general internal medicine folks. Some pediatrics and some OBGYNs are counted within the primary care physician group in general. They're skilled in 4 C's. The first, contact, continuity of care, comprehensiveness of their care, and care coordination with the specialist. For people with either an undiagnosed sign or symptom or ongoing health concern. They provide the best foundation to attain what's called the quadruple aim, which is providing high quality care at a good cost and improve care outcomes for patients while also sustaining provider satisfaction. And the patients are best served when your PCP or your doctor is working in an integrated practice care environment in which whether they have allied services like primary care, the physical therapist, health coach, they work together hand in hand and have a care team approach. So that's kind of the primary care and directionally when they work the best. Well, we have seen some of the trends in PCP care and ratios that had led to more care move into emergency room, urgent care, and specialist care. If you recall, some folks possibly can recall the 1960s where doctors were actually coming to home and doing home call. There are small fragments of those physicians still working today and doing home call. And then in 1970s, we saw some movement into more solo practice in which the patient now went to the doctor. But we're seeing trends that are kind of concerning and creating almost a crisis situation in which in 2019, the PCPs were reduced to only 1/3 of the doctors, and majority worked as employees for someone else, whether it's physician-owned or non-physician-owned organizations. And we noticed the increase in emergency room utilization through 42% out of 100 people were getting their care from emergency room. 42 out of 100 people were getting care going to the emergency room. So that has, and part of it is the ratio. One PCP takes care of nearly 1,500 people in 2020. That's the number. And only 42%, 48% are owners, and the rest of them have become employees of large organizations. So with that, we are seeing some interesting transitions.
Right.
Bambi, back to you.
Yeah, so that's the traditional model of primary care that many of us are familiar with. And of course, many of us are familiar now with this new world of chatbots, and they would also be, I would call them the AI navigators. We have K-Health and Bowie joining us today, but there's also Wobot and 98.6. We also have these new virtual care clinics. We started with more of a telehealth layer with Teladoc a decade ago, but then we had new players like Amwell, and then even newer ones like Firefly Health, who's going to be joining us today. Of course, retail clinics, I'll show you some numbers there. That exploded, but we would obviously with CVS, Walgreens, a number of new clinics that are emerging. And interestingly enough, when we took the survey, when everyone registered, we had a number of people say primary care was their first gateway, but retail clinics was number 2. So that's interesting. And then we have new urgent care clinics like Carbon Health. I call these tech-enabled clinics. And then of course the concierge clinics, and that would be Eden Health, which is joining us. And then we have a number of on-site clinics. These are clinics at inside corporations. And what we're also seeing is not only just this access exploding, but we're seeing an integration with specialists in real time. And whether it's a cardiologist or endocrinologist or gastroenterologist or therapists that are helping you with your weight or smoking cessation or with mental health, now we're seeing this integration. So no lag time between a primary care doctor and a specialist. So primary care doctors are now are armed with a number of resources. So some of those trends, as I mentioned, we're seeing a surge in urgent care clinics, up about 30% in the last 5 or 6 years, 7-fold increase in on-site clinics, 2,700 retail clinics now. That's up a little bit from 6 or so years ago. And then, of course, as everyone knows, we are utilizing a lot of virtual care. We saw a huge spike in 2020. That has settled to around 17%. Some say it's about 11%, a little bit lower, but it's still significantly higher than 2019, of course. And what's interesting as well, and Arshanath touched on this, was that we had a number of doctors back in the 80s that had their brick and mortar solo practices. Now, 2021, doctors still somewhat want to work alone or have a solo practice, but now they're freelancers working for larger organizations.
Yeah, and we are noticing concerning trends, especially primary care is not attracting more and more residents. So we are seeing only 31% of doctors, they work in primary care. And then the demand is kind of, there's a dichotomy in the demand. We notice that the younger population, they do not have a concept of primary care physicians, which we look at under 30, fewer population has a primary care physician, which is down from 71% to 64%. And we notice more utilization from polychronic individuals in older age. But from 2007 to 2016, the mean number of PCP visits decreased by 20%. Having said that, cumulatively, 46% of the visits were still going to primary care. So some of the reasons why we are noticing these trends are the high deductible PPO plans that are really letting people ration out their money and keeping them closer to specialists, away from the primary care physician, because they feel that they're getting more focused value from whatever their chronic need is to go to see the PCP. So they're saving their out-of-pocket cost to go see the specialist because of an open network. Having said that, the specialist focuses on one condition, one body part, and not a whole person approach. And that is leading to some of the problems that we shared before, and outcomes are impacted by that.
And of course, spending is impacted by this, and many of our guests and speakers certainly know these numbers. The US spends twice as much on healthcare than any other country, a lot of this in downstream costs. And what's interesting is that where we should be spending, we're not. So the US spends, while we spend twice as much as every other country on total healthcare, we spend half on primary care. So we spend about 6% of our total, nearly $4 trillion in spending. 6% is spent on primary care versus 14% of their spending. In other OECD countries, 14% of their total spending goes to preventative care, primary care.
So as we saw in the beginning, that the primary care physician really looks at the 4 C's and more comprehensiveness around care, which is really very much high value care that the individual gets. But the financial incentives are really fee for service based. So even though on paper, 57% of physicians have moved over to value-based, but they're not 100% moved over to value-based because 48% of physicians are still billing through fee-for-service. And if they're solo practice, they're billing at 70% level, which is really still having financial incentives focused on procedures, the number of visits, the higher you can bill, and totally misaligning the incentives that are going away from a value-driven primary care setting. And part of it is, and we can have a longer discussion on this, but part of it is that the payer, the insurance companies, we're not sure if they're aligned to the lower cost because the premiums have not dropped. Premiums continue to rise. More cost is being passed on to the individual in the form of newer programs like HighDeductible plans, HSA. So those kinds of plans are still striving and driving, we're not moving away from a fee-for-service to a value-based model as the payers aren't as incentivized.
And this is going to become a problem, right? Because there are many cohorts in healthcare, but we're going to talk about two of the ones that Archana and I feel are a real problem and a challenge to the health system. Of course, we have the older generation, they're the sick and the aging. People over 55 account for over half of total health spending, and there's going to be more of them over 65. In fact, by 2030, there will be 71 million people over 65, up from 46 million today. And then there's another cohort, and I think this is the cohort Archana and I call the ones falling through the cracks. This is the younger generation. Everybody calls them healthy. Some call them healthy mavericks because they're healthy. They don't see the PCB. But actually, as you saw, there is a trend toward not seeing a PCP, not because they're healthy, but they just don't see a PCP. They just don't have an affinity with the PCP. They also have higher rates of depression than any other generations. And surprisingly, I don't know if many people know this, they actually vape quite a bit, and vaping leads to smoking. And smoking, you'll hear a lot about that. I think a lot of people just ignore this unhealthy activity. At nearly 1/3 of our high school kids are vaping, and that's a problem. Not only that, K through 12, 1 in 5 are obese, and this is more than tripled in a generation. So if you think about smoking, mental health, obesity, these are problems that we are going to see down the road, and they will challenge our healthcare system.
Yeah. Well, not everything is doom and gloom here, but as you could see, we are talking about primary care physician and having a limelight because they bring value to the health system. And our investment into digital health has identified that. So we're seeing far more superpowers in the form of technology and digital health that has been provided, especially to the primary care space. But as we know that the VC money is flowing much, much more in the last 2 years, especially if we noticed that we crossed a 10 billion mark at nearly 15 billion in 2020. And just in 3 quarters, we are upwards of $20 billion in investment in digital health. And we do feel that allows our physicians, our clinicians, our providers, especially primary care, to be able to deliver care at a higher level and scale it. And as we go forward, here are the kind of clusters of primary care innovations that we are starting to see. We do have some that are on the panel today, AI navigators that are the front door that provide almost triaging opportunity and connecting, matching to the right kind of clinician, virtual care solutions that started off with Teladoc and then expanded out, to Firefly and more, and included health, which is also kind of care navigation merging into virtual care, and then direct to consumer. And some of these companies have bypassed the payer completely and went directly to consumer, and then the payers are adopting them as part of a network. We see a lot of innovation in home care, especially that group that Bambi was just talking about, that does utilize primary care more. Getting care to home makes it more efficient and better outcomes. We do see connected devices. So if you think of navigators, virtual care, direct to consumer, home care, these are primary care networks and tech-enabled clinics. These are the horizontals, and the connected devices paired with care become the verticals in this space. So we see, mental health provider like FreeSpira, tobacco cessation, Alive Core, Tyro Health, Echo. These are innovating each one of these cardiovascular space or mental health space. And then we have disease management platforms like Rhode Health that is focused on reversing diabetes, and Omada that's looking at weight management, pre-diabetes. So, and Livongo and Oshi Health. So these are ways that primary care market is starting to kind of coalesce together to offer better offerings for our individuals.
Great. But finally, they can't all exist. There's a lot of money going into this space. And so I don't think anyone thinks these valuations can be sustainable. So they're going to have to become bigger and better companies, but also we need to see the integration happening eventually. It's inevitable. So some of the more recent ones, 23andMe buying Lemonade Health, that was probably one of the more recent ones, but over the last year, we've had some really interesting combinations, such as on-demand, bringing primary care and grand round secondary care navigation together. Headspace and Ginger, a little bit different in the mental health space, more clinical and subclinical coming together. But as you can see, people are starting to figure out what lane they're going to be on and how they strengthen their value proposition. So as we looked at all of these trends and we've seen the consolidation, we see where the money's going, we see where the pain points are, Archana and I really wanted to tee up the conversation by asking, well, who are the winners in the space? We think that for sure, those that are value-based first, that have this value-based approach, that embrace these economic models that prioritize prevention and primary care, they're going to be the ones that are going to be laser focused on delivering the right type of care. And they're the ones that will achieve the quadruple aim that Archana mentioned, which is sort of overall cost coming down, overall population health improving, and quality and satisfaction for both the provider and the patient. We like the ones who are collaborative. They're leveraging the technology and the care teams and or the specialty partners, and they're leveraging that approach for what? Well, for frequent check-ins, not for annual check-ins, but frequent check-ins, but also for those times for acute moments where there needs to be real-time decision-making, and the primary care physician needs to engage with a specialist. And they're service-oriented. We do live in the Amazon world, so we have a consumer mindset. So these are companies that are going to deliver a modern and customer-facing experience. So with that,